Anthony Kelada. I am a psychiatrist who's working at a private clinic and in a hospital setting as a consultant and in the emergency room for psychiatric situations. I also am considered an associate professor as I have clinical rotations for third and fourth year medical students at California State Northridge Medical School. There are many rewards to being a psychiatrist, including being able to help people from their emotional pain and suffering, teaching them about healthy ways to deal with life that do not have to rely on medications, and there are many job opportunities and financial incentives that allow me to work basically wherever people are living. So there are challenges as well in the field, including hearing about the difficult lives that some people have been through, and people who need treatment do not want to get it at times, so that can be challenging. A typical workday can start at 8 or 9 a.m. and it can vary depending on the location where I'm practicing. In my office, it usually involves me seeing patients every 20 to 30 minutes and then trying to manage the administrative aspects of what it has to have an office. While in the hospital setting, I see patients in about the same amount of time, and there's more interaction with other physicians and staff to educate them about the patients and provide my clinical guidance. So there's a few adjectives to describe psychiatry. One is it's humbling. Christ is working through me to help others. It's interesting. Human behavior can be unpredictable at times due to man's free will. Yet, due to history often repeating itself and human behavior often repeating itself, in this case, human behavior can be predictable at other times. And it's also, so I think, humbling, interesting, and lastly is discerning. To know the best direction to go to help a patient or deal with a problem is not always clear. And so those psychiatrists in my field are the other ones that I work with. They're typically described as kind, funny, and maybe a little crazy. Balance is an important skill to develop in a career and for your career and personal life. And simply put, it requires putting God and church service first, and everything else will fall into place. To be honest, that probably is with any career. Being busy outside of working hours is important as well. In order to prepare for a psychiatric career, it's important to have a good background in the field. At least it was helpful for me. I was a neuroscience major in college. I was able to overlap this to my interest in psychiatry. As a medical student, I did research in psychiatry and presented my findings at national conferences. It sounds fancy, but really anyone can do it if they put in the effort and have the right guidance. So there are different career paths one can take as a psychiatrist, including working with children, working in addiction centers and hospital setting, outpatient clinics. Those are just to name a few. Working in an office setting can feel isolating at times, yet it's good to be your own boss if it's your own clinic and choosing your own hours. In the hospital setting, you're not always in charge of your schedule, and sometimes you're asked to do things which aren't typically your job responsibilities. One analogy I like to give is someone who signs up to be a fireman and just really wants to put out fires, and they have the gear on, they have the hose, and they get the phone call, and the phone call is to take down a cat from a tree. So not exactly what they signed up for to being a fireman, but someone is calling for some help, so you're there to give them some help the best you can. On the other hand, it's in the hospital setting, it can be good to see other patients with medical problems, keep fresh the knowledge obtained during medical school, and you're also trying to help and educate other physicians as well. In the future, because I see the psychiatric field taking more of a administrative role in governmental positions, just because I think mental health disease can place a strain on society as a whole, and I think these problems are best addressed on a systematic level. There will always be a need for patient care. I don't see that much advancement with the medications in the near future. If anything, I think there'll be more of an emphasis on therapy, like psychotherapy, being done. And I think as a Christian, really Christ is very therapeutic and can provide very important mental health healing. And so I think it's a great avenue to guide people to Christ. So there are many ways in the community to help out as a psychiatrist. Such a huge component of the general population could benefit from mental health services. And many times a good background in Christianity can help one to be a better psychiatrist. So you can see patients individually or in group settings, like as in group therapy. A psychiatrist is pretty knowledgeable about topics that are interesting to the general population, such as stress management, dealing with addiction. So you could give those talks to like groups of people. You could help out in a clinic, like a free medical clinic. Also, just listening to someone who's going through problems without passing judgment is a skill that's learned in therapy that can apply to many different situations. Also, oftentimes as a psychiatrist, you really have to be aware of like your emotions and feelings and have to have patience. And sometimes just in the community, having patience with certain people can be helpful. So personally, my desire to become a psychiatrist, I think was fueled really when I heard about the interesting stories of the patients I met during my third year medical school clinical rotations. And that's about it. You guys can contact me if you have any questions. If you like, it's my email address is my name, Anthony Kelada at gmail.com. That's ANTHONYKELADA at gmail.com.